someone else asked a question, but we paid for it. I know, but time out a second. But the reason why we paid for it is because we had to put Americans back to work. Okay, when you look at a car, okay, now someone says, you know, where's that $2 billion? You pay $20,000 for a car at McCaffrey Ford, okay? That sales tax, you know, part of it is that we're given, about if it's a car that gets certain amount, you know, $3,500 tax break or $4,500 tax break, you know, the turning your clunker, okay? But you're getting back that in taxes on your state taxes. And so, but some of it, but I'm just being not, but I know you, but part of it, ma'am, and I just want to make sure that I'm clear. In that last September, and people forget this, it's only one aspect of it, but the stock market and the economy in America, it was cut in half. Now, the stock market's only one part, okay? But our economy, we were in trouble. I mean, I met a young woman over at the Cool Needle Diner on 13th, whose husband was employed. He was trying to get by. She's been unemployed. She has a college degree. She's working. She sat across this congressman corner that I do all over the county. She showed me her finger. She had to sell her engagement ring and her wedding band back, just so she could keep a roof over her two kids. You know, and so this is what we're trying to, and it has to be in a limited way. I just want to make sure that I'm clear. It has to be in a limited way to put people back to work, and that's what I'm trying to do. I am for balanced budget. I'm for the balanced budget amendment. But there are certain times when you have to unbalance the budget, including during times of war and times of economic crisis. And I felt that this was, and I think all economists, conservative ones, liberal ones, would say that, you know, this was the worst recession since the Great Depression. And my job was to make sure to put this stimulus, this $787 billion, the kickstart economy to go back in the right track. I mean, you look at last night, we haven't had every month in the Obama for the 7 months in, on the stock market's gone up. Now I know it's one indicator, and I understand too, unemployment, at least in Bucks County, it's 7%, so it's not as bad as the 9% nationally, and that's always a lagging indicator. But you know, we need to put Americans back to work, and that's because we have to grow our economy through this thing, but we have to do it in the right way, and that's why I'm for. And one last thing, the folks on the right that criticize me on the stimulus fund, they're like, well, you only spent 15% of it. I'm like, yeah, because we're making sure that we're spending the right way. We're not just throwing money, and part of it is like, listen, guys, you know, we're in this together. This is a national crisis. So that's my philosophy on that. And your last comment or something now.
Okay.
Yeah. Mom, you had your chance.
I do have a question, but I just want to tell you about me first, okay? I have worked 2 jobs in the course of the year. My husband's a small business owner. We lost it. We took all the debt back. We paid for our employees. They never missed a pay. We did. They never missed a pay, and we always paid for their health care. Private health care. Okay, so that's who I am. My husband's working 3 jobs now.
How much is each of the employees the cost to provide them health care?
Well, you know what? It was $900 for my family. I don't know. I can't think of the
Okay. No, I'm just asking. We're having a conversation. This isn't. Yeah.
Right. I mean, I can't remember.
So,
Okay.
but part of what I'm doing, I'm not sure if you heard earlier when I was talking, was to give you the 50%. The tax incentive to do the right thing by doing that.
But I'm doing the right thing because I am being responsible for my brothers and sisters, the people that work.
I'm not arguing that you aren't.
First of all, I'm an American. I'm very proud to be an American.
So am I.
Okay, but let me speak.
Okay.
I'm very proud to be an American. Okay. And I want everyone here to know and acknowledge who helped the world with the tsunami. The Americans did. Americans are the greatest and the most generous people. My question is, okay, what do you think about the Waxman letters and how they've been sent to all the insurance companies? And how there's intimidation from those letters. How can we live? This is America. If you don't support me, I'm going to threaten you. I'm going to intimidate you. This can't be. This cannot be.
I will tell you that I didn't vote for Harry Waxman, and when it came up in the community assignment thing, I voted for John Dingell out of Michigan. Okay, so. All I can say, but I'm going to be honest with you. I'm answering your question. Okay, this is an American challenge. So we have to come together, and we need private industry to come in here. We need the doctors and the nurses and the healthcare providers in here, as long as it's everyday citizens. And this is what this debate is about. Now, luckily, you know, we've had everyone come to the table. We've had hospitals come to the table. We've had the AMA, the largest group of doctors. Now, it doesn't include all the doctors, of course, but okay.
I'm also a social worker.
Okay.
I'm also a social worker.
But all I'm saying is that we all have to come together, you know, and do the right thing for our country. And we all have to, and that's how we need to tackle this problem. This isn't, you can't go to one industry or one person, you can't go to the taxpayers and say, hey, Madam Taxpayer, you got to pay for this bill. Because you can't afford it. We all can't afford it. But no, but ma'am, that's not, I just want to make sure, the majority of the money of $3,200, now it's implemented right now, is the concessions from private industry to come to the table. I can read you the pharmaceutical industry, which, by the way, employs 6,500 people in Bucks County. Okay, I know people want to hit pharmaceutical, but we actually make the drugs that save literally millions of lives every year in Africa, all over the world. We manufacture in Bucks County in America, and that's something that we should all be proud of. Those 6,500 families that do the right thing, okay, they're coming to the table. Their industry, farmers come to the table and say, listen, here's $110 billion. That's what they're paying under this bill with the concessions. And why? I mean, it's a business thing for them too, is that they're going to have more things. But and the majority of it is coming from private industry who's going to pay for it. But it's doing it the right way. And I'll gladly work with you on the waxman to do the right thing. But I just want you to know, I'm not turning to you as the congressman saying, I think the taxpayers should pay for this. I think it should be a partnership. Okay, listen, we need more Americans to pay into it and pay for their own health insurance. Or employees and pay co-pays and et cetera, and make it transparent. And again, these are the principles I'm fighting for. But I just want to make sure, and that's what this bill is. And I just want to make sure that we're all tracking. That I'm not turning, to the American taxpayer and saying you have to put this bill. I'm not turning to the pharmaceutical and saying you have to put this bill. I'm not turning to the doctors and saying we have to do this together. The doctors need help. They're getting squeezed. The medical care profession, as you know, as a social worker, they're getting squeezed and squeezed by the health insurance companies. Now, I'm not against health insurance companies, but they need to come to the table and say, listen, and we're mandating some of it too. Because sometimes, again, as a guy who believes in unlimited government, part of my job is I'm not the player. I'm not trying to be the player as far as the federal government. But what I am trying to do is saying, I have a role as a referee. I can't look the other way and expect them on their capitalism just to do the right thing all the time. Because they won't cover people because they had hay fever 10 years ago or asthma 20 years ago, and because it's a pre-existing condition. And that's what I'm trying to mandate and saying, listen, I want to partner with the health insurance industry and saying make sure that they can't discriminate based on pre-existing conditions. So, okay, and then hopefully all the time.
Like your wife, I'm a Republican, but it seems to me that part of the answer is doing some math. If 1/3 of the 47 million people go to an emergency room a year, depending on where you are in emergency room,
it is. It's going to get
$500,000. Let's say it's 750. 1/3 of those people go to the emergency room. That's $11 billion per year. There's 600,000 people in this country who undergo bankruptcies, which are medically precipitated. On average, they default on $30,000 a year. There's another $18 billion a year. Now you're pretty close to $32 billion a year, every year, that we're already paying. That we are already paying. Now, but the difference is we're paying for that at the highest possible rate. We're paying for that at 3 to 4 times what people could get in a physician's office or a clinic if we were proactive about our health care. It seems to me that we don't need a lot of new money. We just need to spend the money we're already spending a hell of a lot smarter.
That's right.
Right on.
Well said.
There's a sign-in sheet back here. There's a sign-in sheet that obviously line it that someone was generous enough, so please sign in. And if you have specific questions, do let us know. We'll get back to you. We need to make sure it's more efficient. And I agree with you, and that's what my job is. And that's what I'm trying to do to tackle this issue, okay? And so when we make it more efficient, part of it is saying, all these folks, if you didn't hear me earlier, I said the exact same thing. I actually go to an emergency room at the University of Pennsylvania, which is a great hospital. It's actually $2,500. It doesn't matter if you have a runny nose, or you broke your arm, or you're bleeding in a car accident, okay? Every single person, $2,500 right off the bat. Now, lower bunks is cheaper, St. Mary's a little cheaper, but again.
It much, because I got tons of bills from lower bunks.
So,
they don't have insurance, and they keep them in the curve. $1,000 to walk through the door.
Yeah. Well,
I'd like to say one thing. This is America.
Yeah.
Not czars,
right?
Communists. Green czar is communist. Now communist.
Yeah.
Constitution's out the window. People lost their way. You work for us.
I do. That's why I'm here.
That's right. And we want the medical plan you have.
And that's what I'm here for.
In my life, period. You didn't have the government. We don't want these big...
Hey, everyone, please listen.
You get billions of dollars. Still, you drill there. They won't drill here. When George Soros called in $800 million.
No, I'm glad he's addressing some of these issues. Think that he has to address them.
Yeah. I'm a Teamster. And I'm out of work.
And what? Today did? Air Force, huh?
Mill's gone.
Congratulations.
Hobbs gone. Meat package